Hi, my name is Jada Carter, and I wrote the opposing argument to healthcare providers' right to religion. First and foremost, I would like to say that it is a privilege to be able to medically treat and service others. Licenses are given to those individuals who have earned that privilege, while medical professionals, whether it be doctors, nurses, physical therapists, pharmacists, are attending school, they are required to participate in residencies, clinicals, and classes that prepare them and equip them with the knowledge to do their jobs and their ongoing professional expectations. Medical professionals are aware of the patient's right to choose. They have the right to either accept or deny treatment. In fact, full medical disclosure and understanding of medical treatment and complications that go along with it are required before medical administration of the services are given. With that being said, medical professionals willingly violate the patient's right, their right to choose, when they refuse services for no other reason other than what they believe, disregarding their original job description, disregarding what they were originally taught. Because healthcare is very broad and always varying and voluntary, patients can choose the best course for themselves based on medical opinion. Just because a medical professional does not agree with a choice that someone has made for themselves does not give them the jurisdiction to say no. Medical professionals, in my opinion, worry more about their conscience than the best care for the individual when they do this. Medical professionals may rebuttal with things like birth control and abortion being a lifestyle choice rather than a treatment for disease, so they're not obligated to do so. But healthcare is a lifestyle choice. Being able to choose what kind of healthcare that you're provided with is a lifestyle choice. The whole field is a lifestyle choice, and so this makes their reason invalid. Medical professionals do also have the choice. They have the choice to be their own boss. When they're their own boss and they open up their own practice, they are entitled to monopoly rights. Monopoly rights give healthcare professionals the privilege or the right to say, no, I do not provide this service. I will not provide this service or this medical treatment, because this is their own place of business. I would rather go to a place knowing that they don't already provide the service that I'm looking for, and looking for another place that does, than going to the place thinking that they provide the service and being refused for it. That's just my own personal opinion. To try to mediate this issue, some states have come up with what's called a conscience clause and also a collective obligation law. And so these are set into place so the patient does not feel like the law has made it legal to discriminate, but also so the healthcare professional can feel like they have done everything in their power so that the patient has made an informed decision going on or going forward with accepting medical treatment. And this is okay with me. I'm okay with the doctors trying to sway me to make a decision in which they think would be better for me than telling me no because they don't feel like it's right for me. This is individual. This is my health care. In conclusion, religion and the right to exercise religious freedom will continue to be an ongoing debate, especially in healthcare. Freedom of religion without imposing on the patient's right is tricky. While my partner and I are obviously on different ends of the spectrum, I do believe the system has tried to meet in the middle with conscience clauses and collective obligation. But is this good enough considering no one case is the same? I think once we add the jurisdiction of medical professionals, we steer the pie in a direction that we never wanted to head it in the first place. Who is the doctor to say that you can't obtain this because this happened, or to limit things like abortion and birth control only to special cases such as rape? I believe that individuals understand what is best for them. I wouldn't want to get on birth control or go have an abortion, which I am against, and be denied of that. Maybe I cannot afford to take care of a child, and I need to make this decision for myself. I think when the medical professionals choose to deny these services and take away these rights, I don't think that they truly take into consideration everything. I think that they only do it to appease themselves and what they believe, rather than taking in the patients and what's best for them and their rights and their beliefs.